Hello there, my name's Shona Ingram and I'm a hearing aid audiologist with Duncan & Todd. In this short video, I'll answer some questions on tinnitus. First question, what is tinnitus? Tinnitus can be described as the perception of sound being heard within the ear or the head, but with no external source. So the British Tinnitus Association described the most common sounds heard as a ringing or a buzzing, a whistling or a humming. Now, what causes tinnitus? There is no clear-cut answer. Tinnitus could be linked to hearing loss. It could be linked to overexposure to loud noise. It could be linked to the wear and tear within the inner ear, the cochlea. It could be linked to a build-up of wax, or it could be linked to damage to the eardrum. In very rare cases, it could be linked to another medical condition. If it's the latter, then as an audiologist, we would refer you to your GP. Can tinnitus be cured, or can it be improved? The first step is to speak to a professional. That could be an audiologist or a GP. As an audiologist, we don't like to talk about a cure for tinnitus, but if your tinnitus is persistent and it's constant and impacting your daily life, then we can help with self-help management techniques to try and alleviate your symptoms. The good news is that management techniques are simple, and the Hearing Link website has a good list of those, as does the British Tinnitus Association website. When we have tinnitus, and it's constantly there, it can impact our daily life and it can cause us worry and anxiety. And sometimes that can prevent us from doing our daily tasks. But actually, keeping going with your daily routine can be a bit of a distraction, which can help alleviate symptoms also. What can you expect if you attend an appointment with a hearing care professional? At first, it's standard practice. We will ask your medical history and we'll listen to what the symptoms are you're experiencing and how they are impacting your daily life. Following this, we'll move on to audiological testing. And some tests could be how you respond to certain sounds or testing the efficiency of your eardrum. And depending on your individual needs, will determine the testing that we use. The whole appointment is your opportunity to ask the questions that you have. Depending on what your test results are, we could pull together a management plan to help alleviate symptoms. But we would be here to listen to your concerns and help. Are there any recommended techniques to try and prevent tinnitus? So, thinking back to the possible causes of tinnitus, avoiding exposure to loud noise, consistent loud noise, be that the radio in the car or listening to music through headphones. Using headphones and ear protection when we're at work, if you work somewhere with consistent loud noise. Headphones and smartphones nowadays have analysers that will tell us when we've been listening to noise at too high a decibel for a prolonged period of time and give us a warning and advice to turn that down. In general, it can be assumed that maintaining a healthy lifestyle will help prevent medical conditions. And as I mentioned, tinnitus could be a symptom or linked to a medical condition. And if you have other concerns other than your hearing, then please consult your GP. So to book an appointment with a hearing care professional, visit www.duncanandtodd.com. If you feel you're suffering from tinnitus symptoms and you'd like some helpful advice, then please visit www.tinnitus.org.uk. Or to find out more about the self-help management techniques, please visit www.hearinglink.org. I hope within this video you've found some useful information, and thank you for listening to it.